Hello, this is Dr. Brad Grimsley in Dallas, Texas at the Heart Hospital, Dallas. And I'm going to explain kind of what we do with the first rib resection and thoracic outlet decompression. So as you can see right here, this muscle goes down from the spine all the way down and inserts on the first rib right here. Also, you have this muscle here going right behind this set of nerves. That's called the middle scalene muscle. So the anterior and middle scalene muscles, they form a triangle, if you will, something like this. And then there's a rib. They both insert on the rib like this. Inside that triangle, here's the first rib. Inside this triangle, you can see the artery goes through there. And also, this is your C8 and T1 nerve root, along with C7 and C5 and 6 up here. So all this brachial plexus that controls our entire upper extremity runs in this triangle called the scalene triangle. And when we do surgery, we remove the anterior scalene muscle, the first rib, and the middle scalene muscle back here, leaving the vein, the artery, and all these nerves completely decompressed. And you can also see this part right here, you had your block. This is called the pectoralis minor muscle. So the block was done in this as well. And when we do this surgery, the thoracic outlet decompression, we also, most of the time, we take out the pectoralis minor muscle right here. Because as you can see, it goes and attaches to the scapula, the coracoid process of the scapula, which is right there. You can't see the whole bone, but that's the projection or the coracoid process of the scapula, which is in the back here. And it attaches there, and it goes down and attaches to the ribs. So this muscle by itself will pull the shoulder forward. And when people that do a lot of computer work, or they do it on their cell phones, or they do a lot of desk work in the cubicle, you can see how the shoulders, the posture will not be good, and it pulls the shoulder forward, and you get compression right in here. Also, you can also imagine if you've got a pitcher that's extending their arm back behind their head to throw a ball, you can see how this could stretch and cause compressive symptoms on the brachial plexus and the brachial or the axillary artery right there. So anyway, that kind of explains what we do. Now, you'll see the phrenic nerve. It comes from up here at the top, C2 and 3, or 3, 4, and 5, keep the diaphragm alive. It goes right across here. We have to be careful when we're taking out the anterior scalene muscle. Sometimes retraction on this phrenic nerve can cause a problem, but it usually gets better with time. Now, I will say, when we're taking out the rib, as you can see, it disappears behind the subclavian artery and all these nerves and goes back all the way back to the spine back there, and you can't see it. So in order for us to see it, we have to take out the scalene muscles, and we have to move the nerves around to be able to get back in there to take the rib out as it goes back there. If you don't take the rib out, then people typically get scar tissue, and it causes adhesions and things. It causes compression problems later on if you don't do the complete operation. If you just take out the muscles, you don't get relief because of the chance for scar tissue and that kind of thing down the road. So yeah, this whole operation takes about 2.5 hours to do. It's very meticulous because we make an incision on the skin, go down, and we identify this muscle first. We make sure the phrenic nerve is safe. We start identifying the subclavian artery because you can get into bleeding there. The lung is right up under there, so the lung can sometimes get a little, because it's attached to the first rib or the pleura, sometimes it can get a little leak in it, and we have to put a little chest tube in to get the air out of there so that it heals up, and that can take an extra day to heal. Obviously bleeding because of the big vessels that go through here. Those are sometimes a risk that we need to bring up. And also the nerves, just moving the nerves around can cause numbness and tingling in and of itself, but that typically is transient and that goes away. So those are all kind of the technical aspects of doing the procedure and some of the risks associated with it. And I have also, in addition to this, I could show you a little poster that we have here. I hope this shows up okay. But as you can see, this is a little depiction of how the scalene muscle comes across in front of the subclavian artery, and you can see the nerves going right here. And then once these things are removed, the first rib and the scalene muscle, the anterior and middle scalene muscle, not necessarily the posterior muscle, but you can see this is another nice picture. You can kind of see the nerves going between these two muscles as they go down, and then of course the rib circles around like that, and it creates a little triangle. So these go through that triangle, and by removing all these, you can see how it frees up everything. This is one other picture right here that kind of shows it without the arteries, and certainly without the first rib and without the scalene muscles. But anyway, if you have any questions, please reach out, and I'll send this on over your way.